Meeting as of March 16th, 2020. It's emergency meetings based around the coronavirus, COVID-19. With that, I think it's a best opportune time. Please shut off your cell phones and let's do the pledge of allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, everybody that's here today. I'm going to start this off probably with an update from my fellow commissioners. I'm going to start with Mr. Albertson. You spent some time down at the hospital yesterday. I don't know what all you want to bring forward or not.
So, according to the hospital,
I might turn on your mic and you had
It's on.
Okay.
according to the hospital, they're thinking this is really a bad deal. And so, the hospital is taking special precautions and screening anybody that comes in their car. And, Scott Langham from the town was there also. Scott, do you want to give us an update on how that's rolling down there as far as the procedure?
We finally got a plan. We got traffic figured out. I don't know, were you still there when we finalized that? I don't think you were. There's one way in, one way out of the hospital now, and in is down 6th. I'm in the side entrance to the hospital there. You'll go through a drive-through screening. They'll put you in one of 2 parking lots. If you fail the screening, you're gonna go to the parking lot by the emergency room. If you're okay to enter the building, you go in the north parking lot. They'll give you a sticker when you're screened. They will not let you in the hospital without that sticker. And they're gonna do that, they're gonna run that traffic control and that traffic pattern 24 hours a day, 7 days a week as of now.
And I contacted North Lake Health Clinic. So they are going to do the same procedure. And, the declaration is mainly so we can get not only federal funds and state funds, but we can get federal employees to help. And, I really appreciate Barry and Todd for that. And so,
James, you have any updates?
I'm still waiting to hear back from the North Lake School on exactly what they were going to be doing. They had a staff meeting at 7. David Kerr was going to get back to me as to what they were going to do. I think a lot of people had concerns with the school closing, what some of the low income families were going to do for a lot of the kids, because they kind of depend on that school for most of their meals through the day. So they will be dispersing 3 buses from the school with lunches and breakfasts for the kids to 3 different locations on the north end in Christmas Valley, at the community center, and Fort Rock and Silver Lake. And they will be dispersing breakfast along with a packed lunch so that the kids have food, and they'll be doing that throughout the week and until this subsides and kids are back into school. But they have to have a staff meeting with their staff this morning, and I don't know how that went. For all I know, they're still going, so. But I came into the IC last night, shortly after pretty much everyone left. There was only 3 people in the IC when I finally got into Lakeview. It's pretty much, yeah.
Okay.
I know.
All right, so what we have is opportunity to declare emergency with that. The reason why we would do that is to be able to leverage the federal funds, the state funds, assistance and all that. At no time are we wanting to create panic or anything. We want people to be wise. We want people to do the correct thing. If you're sick, stay home. Everything that we've read, everything we've been told is separation is the best thing. So even if you believe it's just a common cold, the best thing to do is keep that separation. Welcome, Denny.
Thank
I want to make sure the mayor has a chance to speak. You were on calls and stuff. Mayor, you have anything?
Yeah, I was on the phone last night for about 40 minutes with the governor's office, and all the mayors that was on that conference call have urged her not to close restaurants and bars down. because a lot of people, elderly people, everybody, construction workers as well, depend on those, as well as your truckers that's traveling and stuff, so we would have to wait sometime today. She's gonna announce whether she's going to or not.
We do have a conference call with the governor's
Right.
office, all the elected officials at noon today, so more will come down from the state at that time. I still appreciate the support of our local businesses and everything. Local business, I really encourage them to be innovative, try to think of ways to keep their businesses going, whether it's delivering food or whatever it is, or drive-throughs or whatever they can do. Our local business have to keep going too, so.
And the mayor's right, you know, there's a lot of people that depend on those restaurants that aren't able to cook or,
Yeah.
you know, and I don't know about you guys, but I would say leave them open anyways. And
Well, you have a lot of truckers that are delivering food to your restaurants and everything else, they depend on those
We'll just-
restaurants.
think about how many workers we have here, how many elderly people that at least eat one meal out a day because they don't have the food at their house. What I'm concerned of more than anything is the hysteria is more dangerous to me than the disease. And yeah, we need to be cautious, we need to be smart, but we have one grocery store. And I don't wanna create a hysteria where people are actually hungry instead of having a virus. And so I wanna make that clear, especially to the media, that just be smart, help each other out. Be there for somebody, you know.
So, I would entertain a motion on the emergency order, and then we could have further discussion after. Get that out of the way.
I'll make a motion to declare state of emergency in response to the outbreak of COVID-19.
Do we need a second in order to have discussion?
Yeah.
I'll second the motion.
Motion's been made and seconded. Mr. Bailey, I didn't ask for a response from you or anything, and we'll do that and then have discussion from the board.
Responses to what?
Everything in this, resolution, I guess, or this order is, as far as you've reviewed, is fine.
Yes.
Okay. Further discussion?
Further discussion, I'd like to hear from our OEM, Daniel Tagg, if you'd like to come up and give us an update.
I don't think that's my phone.
It might not be. That's not. Yeah. Gotta switch that little switch in the back.
You good now?
Yeah, you're good.
And thank you, Dave, for all your work.
So yeah, basically the hospital's working on a drive-through screening process. They're getting some help with that process. They don't have enough staffing. And part of declaring this emergency frees up the ability to get some resources they need. Even if they're paying for it, it bypasses the contract process, the bidding process, some of that stuff.
Right.
So there's some legal measures during this emergency that allows us to do that right away versus waiting.
Got it.
So we've also used some local resources, state and federal resources, working with the hospital, helping with the incident management system and public information officer, and we've also requested an incident management team to kind of come in and help shadow them. And I don't know, we're trying to get our local type 3 team, which is a federal team, a little harder to get to. We also may put a request in the OEM for a state team. The Oregon Health Authority has stood up the state fire marshal's team to help them with this process at the state level. So those teams are getting gobbled up pretty quick.
Okay. And you're working with Northlake at the same time?
So yes, we were having lots of discussions on North Lake yesterday, seeing what their needs were too.
Okay, very good. Appreciate that.
So Daniel, on your incident command and how we're gonna notify people about what's going on, where do you want people to go right now to look? Scope them, or do we do something different, or?
So public health is tasked with that part of this at the county level. So
So
we've plugged in the SCFUNC and the federal folks, the federal Forest Service Public Information, so we plugged in with Judy to help with that, because the fund has a few more resources to actually get out a little quicker. So they should be coming out with where that information is gonna be today, if they haven't already.
Is our emergency communication system is it active? Can we actually use that if we needed to get messages out to the public?
No, there's a meeting the 25th that the guy was doing a training on
Okay,
that, so it's moving along, just not implemented yet.
just wanted to check on that.
All right.
And one of the questions I had before we move through this, and maybe Daniel could help me with it, because we have in the very top, we have in the matter of declaring a state emergency in Lake County in response to the outbreak of COVID-19. We have yet to have an actual outbreak in Lake County, correct?
As of yesterday, I don't have any confirmed cases. That was yesterday.
I just want to clarify that part of it, and that this is primarily for the purposes of utilizing resources and the prevention and as a precautionary measure moving forward. So,
And trying to get ready for it if it,
Yeah.
they're saying it's gonna come through here, but
right,
It will, yes.
we won't be ahead of the curve for that. That's the
Correct.
case.
There's no confirmed cases, but I believe it's here already, so.
I have a question just on the restaurants and some of the events that are still going on in town. When I canceled Irish Days dinner, I heard from several of our elderly women who came and thanked me because they felt such tremendous guilt, even though they are scared to go to large gatherings, they still want to support them. And so they put that ahead of their personal fear to be around more people, even when they have underlying conditions, even when they're sick, their need to support the town. And the events is bigger. And they thanked me for taking that guilt away with Irish Days dinner. And I think that's important for us to think about is even when they are scared to go do this, if we keep these events going and if we keep these things happening, they feel a bigger need to attend and they're our most high-risk population. We have to give them, I think, some kind of out, that it's okay to stay home and we have other resources. So what are the county's resources for restaurants if that order comes through? Do we have any resources that I can give our businesses and communicate to them that, we're already working with Annette Lee with the governor's office and we'll be finding other resources, but they feel a very severe sense of support, which is normally wonderful and normally great, but the problem is they go to these things and then they go to Bridge and then they go to, they go and they visit and then they drop food off and then they go and so I'm concerned for that population because of their great sense of volunteerism. And I think we need to take that into account.
I think this is new to all of us,
Yeah.
Jessica. And I think there's gonna be a lot of people stepping up, a lot of different things. We don't know what we will be able to leverage from state or federal for assistance with that. We haven't even got to the second part of our conversation of our own county operations at this time. But I do have a lot of faith in our community and our people. And a lot of people will step up. We will try to leverage everything we can as a board of commissioners. All this is get ahead of the curve, and what you're saying is trying to get ahead of the curve.
Yeah.
We haven't had no discussion about what resources are available. The restaurants, they got to be creative in the way they're going to keep going. I really believe that. The gatherings, it's just common sense now. Everybody has to make a personal decision. Step back from the gatherings, stay home. Even if you're not sick, limit the number of things you're going to go out and do.
There is a sense of defiance for our governor that they're going out and they're thinking this is just all something that she's done to punish us, when even though it's going on all over the world. And there's a sense of personal defiance to attend these things because we're going to show her kind of thing. I think we need and you guys are providing that, and the town will be providing that, we need some kind of leadership that tells them, we want you to stay home. We want you to put your own, your own safety first. You don't have to attend these things. You don't have to go. We'll be talking to the restaurants about, really putting out some runners and delivering carside and talking to them about takeout. But still, I think it needs to come from all of us collaborating and working together because they have this great sense. Our community is wonderful in that way. They're gonna be looking to all of us to tell them it's okay not to go to these things.
Just to add on to that, I think the messaging that's gonna be coming out is gonna be really strong to that effect.
Okay.
And that should be already out if it's not. So we can go short.
So there's gonna be a full page article coming out in the newspaper this week, and it's got some pretty heavy duty language in it.
And we can utilize, Chamber Chatter reaches almost 3,000 people every week. And it's on the radio too. So the chamber is more than open to helping getting any kind of messaging out. And, we'll be there for that.
All right, any further discussion? All in favor of the order?
Aye.
Aye, motion carries. So that's enacted as of now. I know that Barry and Mark worked on, Barry Emler and Mark worked on this so that hopefully everything's right in there to be able to leverage the federal assistance and everything. Barry, do you have any updates from the Forest Service / BLM side of operations or how you guys are handling that? It's pretty unique for all of us that in leadership role and when we have essential functions that we have to do, we have operations we need to do and employees. How's it going through your process right now?
I'm getting multiple sets of direction and update every day.
I think that's what we're all gonna be dealing with almost hourly.
I would say, in general, our direction is to continue essential operations, take care of employees at the same time. We will be, as of about an hour and 15 minutes ago, our offices will not be closed, but the doors will be locked. And there will be a sign on the front with a phone number saying, if you need services, in-person services, you need to call this number. And we've got some screening questions we're now going to have to have people basically self-certify before we can make arrangements to.
And that's what I was advised by Lisa Cahill this morning, is that we need to screen people
Well,
coming into the courthouse.
yeah, we it's not as easy for us to just say the courthouse because we have other operations out there and we have mandated jail and operations up in the jail. We operate a landfill, we have an annex up north,
Road department.
yeah, road department, and so we have some pretty unique, I like what you're saying there. We also have, and Amy said in the back, we have the state court system that has to operate through the courthouse here. So our decision and what we're gonna do with the courthouse impacts a lot of operations. So,
Right, and like road department issues, we've got a snow event right now, we can't just shut everything down.
Right.
It would impact things a lot worse and we'd end up with more emergencies on our hand than we can handle.
Well, the thing is that this document, this is what it says right now, but it's gonna be fluid.
Correct.
Everything we do is gonna be
Situation
fluid,
is changing.
because tomorrow, we might have to make an amendment. We might have to add some stuff
Correct.
for Barry's end of it. And so, everything we're gonna do from now on is going to be pretty fluid. And if, well, you told me this yesterday, well, that's different today. And so,
well, and that's leading right into, we have a second part here where we were gonna discuss and work on, and that's the temporary policy response. And I would like to, I wanna make sure that it's okay that if we don't adjourn this meeting, that we continued on after 12 o'clock, after we have the call with the governor's office, before we make any other decisions, because I think exactly what you said, more information we have about the operations of the courthouse and the county operations and the state operations, we will know more. Give us a little bit of time. Mr. Bailey, are we able to continue, just recess an emergency session and come back, say at 1:30? That would be. So I asked the board if you would like to do that.
I think that's wise.
Okay.
Do we, if we have the governor's phone call happening at noon, do we want to have the conference call in this room and then convene directly after that call?
Yeah.
Okay,
I believe.
yeah, that's fine.
I think there's gonna be quite a bit of the audience want to come back, so maybe if we set a time and then they can, their schedules,
Noon would be when the call is.
when the
so,
call is.
Yeah,
It
I
should-
hope that it wouldn't happen, it wouldn't go on for an hour
I
and a
don't
half.
think so either.
Yeah,
So you wanna go for 1 o'clock then?
1:00.
All right, so, unless there's other things you guys would like to go over right now, or we can work on bring more things forward, we'll recess until 1 o'clock. All right. Thank you, Mr. Bailey. Thank you, everybody, for being on. All right, being here. Thank you. Yeah, bye.
Have, and that's what we're trying to deal with. So when I say operations are not as usual, if you try to get into the hospital today, you'll find Forest Service people, personnel blocking you. You will have people from physical therapy doing a health screening on you. You will have people from the business office out with a different code, they're wearing different hats. So we have moved our personnel totally around. We are not seeing patients in the clinic who are well. So if you have a well child visit, you're not being seen. Obviously, there are people that still need to be seen and they are screened and they are allowed to come in. It's the sick people that we are stopping. That goes through that anybody, if you walk into the hospital, part of that screening is, are you sick? Are you running fevers? Do you have a sore throat? Do you have a runny nose? Do you have shortness of breath? Do you have a cough? If you do, you exit, you leave. You have to leave. You have to be symptom-free, 72 to 2 weeks. 72 hours to 2 weeks is what we're saying these people have to go home. As far as personnel, there's 1,100 people, medical personnel people with this virus. So how do you still run a hospital when there's not that many of us? So basically, those people who are sick, they get to work in the contamination part. So it's very interesting at how this is going down. It's very interesting of how we're triaging people. So even though we are doing home visits, if we have a tremendous amount of elderly in this community, I can't expect them to come run through a screening in the parking lot. So there's some of us that are doing home visits. I've done home visits this Friday morning. We go out to the elders. But then it's going to be, how do I get medication to those elders? How do I get food to those elders? So this is where the county, this is where other personnel, other than maybe their next door neighbor, may have to run to the grocery store for them. This is what we need to think about. This isn't life as usual. This is how are we going to keep all of us safe, quite frankly. It's not if we get this virus in Lakeview, it's when. So instead of having this big, huge, sharp bell curve that everybody is sick on the same 2-week period, we are trying to take that out for 6 weeks, 8 weeks time frame, so that hopefully not all of us are sick at the same time, so that we do not just really kill our resources all at one time. We have pooled everything as far as EMS, as far as hospital, as far as public health, as far as our disaster trailers. We have pooled stuff out of that to try to figure out what do we really have. And this is us working together. But you also have to have the mindset that we're on our own. We're on Gilligan's Island, nobody's gonna come help us. We have to do with what we gotta do, and there's gonna be some hard decisions that we're gonna have to make along the way. So you just have to keep in mind, it's not business as usual. It's for the goodness of the group, of the mass, not just the individual.
Thank you. I'd just like to add as questions come to all of us, let's try to get those questions to the right people, not try to answer some questions that's not within our wheelhouse and what we do and everything. But I would like, if you're comfortable, Lisa, open it up if there's any questions from those of us that are here.
Sure. One thing I'll say is the ICS at the hospital is meeting twice a day. The physicians are meeting twice a day, sort of on a different level, or more as an ethical level. But they're, and we're each walking away with our orders of how we're doing things. So if there's questions, I will try to answer.
All right, thank you very
Yeah,
much for
thank you,
coming.
Lisa.
Appreciate it very much. So board, where I'd like to go is we have a lot of our staff here. We're learning as commissioners as we're going. We want to keep the functioning of the courthouse, the county, all going the best we can. So to rely on each one of you department heads and elected officials to try to keep services to our public out there the best we can during this crisis would be appreciated. We don't want to put none of our employees in any danger, naturally. If any employee feels sick or whatever, they need to go home and stay home for that amount of time. So as you're making your department run at the level that you think is necessary, keep us informed. If we need to pull a meeting together or whatever, we'll do that also. The Board of Commissioners are only going to have essential meetings as far as our operations, action items only. We're not taking any presentations or anything in our board meetings. We will still have our board meeting tomorrow. It will be closed to the public other than what is necessary for department heads to come before us. I guess we don't know, we haven't talked, I'm going to look to my board. We haven't made a decision of how long we're going to keep the courthouse shut down at this time. We don't know exactly what we're going to do. Our employees are in limbo out there. We know today that we sent people home for the day. So I think between us and our staff right now, we should discuss what we're going to do tomorrow. It's almost 2 o'clock in the afternoon.
So my thought is, and Lisa could probably help, but this is active for 14 days, and, right? And until we find out,
Well, I'll say a couple things. I'll say number one is if you look again, if we learn lessons from Washington County, who got this spreading? EMS. So EMS was brought in to the nursing home and they had gloves on, they had masks on, but they were not gowned. So they transport these folks that were positive. They, took appropriate PPE as we knew it at that time. They went home, they spread it to their families, they spread it to police, they spread it to fire, because we now know that it can live on your clothes for a week. So the problem becomes is if you're gonna let those folks come in, I highly recommend that you do like the hospital, you take your employee's word that they are healthy, and there's a checkoff that I gave to Commissioner Albertson that the hospital is using, and if they say yes on any of those, they go home. They go home until they're at least symptom-free for at least, and that means symptoms-free for at least 72 hours after they're symptom-free. So that's usually sending people home for a week, if not 2 weeks. If you look at the CDC, they're recommending that they stay home for 2 weeks. Well, that's, these little communities, we have a difficult time operating that. You are taking them for a word that they're sick and you're sending them home. So that means that they're not gonna get notes from their doctors. We're not gonna write, 1,000 notes saying, yeah, we told them to stay home. This is where you're gonna have to open up your mind here a little bit. And you're gonna have to let them use their sick leave, or you're gonna have to let them, again, it's not business as usual. But we are really recommending that, all of our classes, everything with Red Rock, everything with the federal The interagency building, they're basically done for 2 weeks. Now, what you take of that, you take of that, but, there's some of those that, obviously we're using some of those personnel, a lot of those personnel can work from home. They, we've opened up even for the hospital that they can work from home. What the county does, that's just a recommendation.
Okay. So Amy, from the state court side, has anything come down on the state side? Or we're unique and we have state offices with our state office?
Well, and that's part of the reason why I'm here, is because if the circuit court's still open, we expect a door to be open for public to be able to access. And so we need to decide how you guys are handling that. We have limited our court sessions, so we're only doing what is extremely necessary. So that's necessary by the statute. So your arraignments, they have to be seen within 72 hours. So those are something we can't waiver on. So that's if somebody comes into custody, we have to hear that. And then anything that is a Measure 11 offense, anything that's going to be domestic violence, anything that has to be heard immediately, civil commitments, those types of things. We've eliminated our whole docket for the next 2 weeks on anything else. We're not having any trials. We're not doing any unnecessary hearings. Our treatment courts have been canceled. Jake just doesn't know it yet. And so we've really limited out the next 2 weeks, but we're waiting on the direction from the county commissioners as far as what you guys are gonna limit on the access to the building for people to come in here, as far as the bar, the attorneys, that kind of thing. Because most of the arraignments and that stuff we can do via conference call.
So could we set up, if you guys, you have to operate at some level because of their statutes and everything. Could we set up that there's a number to call and then there'd be a screening before they were allowed in? Would your department screen those people before they're allowed in? And at least that's sort of going towards you, is the screening you have set up acceptable for that type of people coming in and out of the courthouse?
Definitely. I mean,
Okay,
it's basically saying that I am well,
Okay.
and that I am here, and again, it's taking the people at face value. It's unfortunately the 40-year-olds with mild symptoms and the early 50-year-olds that are passing this to everybody.
Okay. So, some of your clientele may say they're sick so they don't have to come in, but I think that's a way to keep minimum going for the State Department. I'm sort of seeing, I think I heard Commissioner Albertson down there, is we have a need to probably keep this building shut down for a little bit more extended amount of
Could we
time.
meet maybe in the middle and shut it down for at least 1 week? And then we revisit this in a week and see if the secondary is, I don't know, I mean, I'm unsure 2 weeks, that's an awful lot to shut it down. And I feel like this situation is so fluid and changing.
So Lisa, like if the germ gets on anything, how long is it live on,
So it's mostly clothing, not hard objects, but.
but like those chairs could have it on?
Yeah. A week.
Everybody just looked at their chairs really hard.
So can we do that? We'll do it for 7 days, and then we'll revisit it, and if we have to extend it.
Well, absolutely, I'm very comfortable with that myself because of,
Yes.
as you say, things are happening. This isn't business as usual. And, well, we also, at the same time, our department heads and elected officials are gonna be functioning at some level.
So I would just thinking out loud here, maybe we close down this wing of the building and typically, and that wing as well. The court upstairs would still be able to function for their primary and absolute necessary needs. But we only do this for a week.
Yeah, but we're not talking general public coming
No, we're not talking.
in. We're talking attorneys only, right?
Well, and so arraignments, right, they're already in custody. So you guys have already brought them in the back door. So we're gonna have
They're
them.
upstairs, they're-
And so then we're going to allow, as far as that goes, the attorneys will be able to join telephonically. The judge will be joining telephonically because we don't want him in the situation to catch it. And then so it would just be one court staff that is gonna be in there. And then essentially maybe the DA, depending on how you guys handle that situation. Can I just ask
So
one question?
they'll have to be self-screened. If you're only gonna have one person in here, we're not allowing,
Would they be screened by the jail personnel though?
We can screen them if we're gonna let them into that.
Okay, oh, if you're going to let someone in, okay.
For that,
Yes.
yeah, we wouldn't mind screening it, but I do have a question that has been brought down on some of my other conference calls today. Have we actually confirmed any cases in Lake County?
No.
Is that something we can talk about?
We
No confirmed cases,
But we cannot test.
okay.
So there has been no testing of any person in Lake County. There are 3 tests going out today. It takes 72 hours turnaround time, but there's no confirmed because there's no way of testing it.
And so what the Board of Commissioners is doing, every
We have
precautionary
symptomology.
thing by the state guidance and through our professionals in the hospital, and the town's following the same lead, it seems like, so.
So, but in the doors will remain locked. I will have to self-screen anybody that's coming up, and then if I let them in, and
So
it's
is
not
your
written.
number on there for them to contact you?
I will have one, yeah.
Yeah, you might have, however many you think.
So the biggest thing about that too that I will say is that we have what we consider hot cases. We have people who are obviously sick, who are obviously meet all the criteria for COVID-19. Some have traveled outside the area, some have been with people who have been positive for COVID-19. Some of them have been in Washington State for an extended period of time, some of them have flown across the country. So they're symptomatic and they have they have the symptoms for it. Again, we have to assume it's here, and medically that is what we are doing. We are assuming we have it here, we just cannot test positive. We can't test for it.
Good. For county operations board, is there anything else we need to do? Right now, we're looking at 7 days from today being closed, so we'll know more. Basically, I would say Friday, we better get back to our employees, but right now.
So what, in our meetings tomorrow, since we're talking about this, is what do we really have to do? I mean, that is a total necessity. Is it just gonna be us at the meeting?
What the hallway talked earlier was, action items we'd still act on, keep county business going. So it would be closed to the public, only those that are necessary to be here. And we would remotely, as far as for people to call in, allow that, and even Melanie's able to get some video type stuff. So, I think we need to continue business and, action items and things that we need to. I'm open to suggestions, whatever, but I'm
Well,
comfortable.
that's fine, I
still
just
running
wanna
the
know what our plan is. Are we just going to be here for a certain amount of time to get this meeting over and then work remotely again? I mean, because we're all gonna be working remotely, correct? Or are we 3 gonna be here?
I plan on being here in person tomorrow.
I may be in and out, but I plan on being here in person part of the time.
Okay.
So I
I
don't
think,
plan on going home.
I think our meeting should be relatively short. But, we are public servants. We
Well,
keep
yeah, and
business
just
going.
because this situation is fluid, I mean, I actually, home for me is 80 miles north, and I can't make that.
Yeah.
Distance, and right now with the weather and everything else, so I'm not comfortable actually going home at this point. So it makes just as much sense for me to stay at my office and work from there as it would to, go sit in my truck, so.
So Melanie, go ahead.
So during this week shutdown, are you directing people to use sick leave? I know we discussed prorating sick leave so that it wouldn't be a hardship, for some people who don't have a lot of a thing to like, if we work 7.5 hours, so each day they would use only 5 hours of sick leave.
So.
I know I'm getting in the weeds, I'm just
Well,
curious.
no, these are all questions our employees want to know.
Yeah.
I see myself twofold. If somebody's truly sick, they need to use their sick leave.
Yeah.
If people aren't sick and they're not essential employees, we have obligated to pay them.
Okay.
As far as I'm concerned, it gets to that, this isn't normal. People are honest and they are actually sick. Using their sick leave would be appropriate. We can't mandate that, but we would appreciate if they would. But we are obligated as a board of commissioners, and this is for discussion, it's not my decision, it's board decision.
I'm right there, I think.
But I feel an obligation, and we're very fortunate to be able to, for our employees to still be paid and, not become part of the problem out there. There's gonna be some people in the private sector, it's gonna be pretty tough on them.
Yep.
So, that's where I'm at, I'm
I think we need to
feedback
pay-
from the board.
I think we need to pay them.
If they're sick, I think they need to take sick leave, but if they're not sick and we're sending them home, I think we have an obligation to
HR, did you follow that conversation? Are you
Yeah.
comfortable with that?
Yeah, that's fine.
Okay. So, there we have it. Anything else? No, I'm just wondering if ought to
That's
just
what the state's
recess
doing.
this in case we
If-
come back in a little bit
They
later.
pay if we
I
send them
would
home.
make that recommendation.
Okay, so we're gonna recess at 2:00, with no absolute time to come back in, but under emergency situation, if we need to, we will. And, sorry, not a lot of people get notified, we'll just be doing business unusual. Thank you, everybody.
We just held it here till the embargo was
We can make a motion.
That was for pro